Cancer protection, these studies, there's two studies that I'm going to mention on breast cancer, both published in the early 90s. This was when, or mid 90s, this is when the United States was really in the thick of low-fat diets for breast cancer prevention. And I never supported low-fat diets. I wasn't clear about breast cancer, but I just didn't think low-fat diets were the way to go. This study in Spain, what they did was they asked women over their lifetime the amount of olive oil they consumed from the standpoint of how often did meals have olive oil in them. And what they found was that the higher amount a woman reported, like we use it every single day, we use it at lunch and dinner, the higher they reported, the lower the likelihood of them getting breast cancer. In this study, there was no relationship of total fat to risk. And this type of relationship, this type of information is useful because it shows that olive oil was different from total fat. Okay, it didn't show any problems with other fats, but it didn't show that they were beneficial. The olive oil stuck out as being beneficial. And in Spain, you have parts of Spain that don't use as much olive oil. It's sort of like Italy. You can have other fats involved. But the women that were raised on olive oil had a lower risk of breast cancer. This study in Greece, published the next year, they reported it as olive oil being used more than once a day versus just once a day. So this is how many meals that they use it. And this one, the Greeks use a lot of olive oil, you probably know. And in their cookbooks, they just list olive oil. There's usually not an amount, so you just use as much as you want. But they found that women that used it, just that small comparison, more than once a day, had a 25% decreased risk of breast cancer. And that's big. 25% is big. If you even get, so anything over 10 is usually what people get excited about. So 25% is really good. Men with recurrent prostate cancer, because of their treatment, androgen deprivation therapy, which is chemical castration, you cut off the testosterone, it's very effective at decreasing the spread of the disease, but it's really effective at putting them into the metabolic syndrome. So their blood pressure goes up, the triglycerides go up, HDL goes down, they get a big waist, and this happens really quick. It's in about a 3-month period, and most of these men were over 60. So these are men that have lived their whole life, one person, and all of a sudden, their pants are too tight, and so there's, there's all these problems that come from it. So he asked me just to see if I could get the men to follow my diet for 8 weeks. So again, I asked them to use at least 3 tablespoons of olive oil, the same basic makeup as the diet that I showed you earlier. And of this, there were 20 people enrolled, 16 completed. This is an abstract, a pilot study. And the mean weight loss was 6%, which was really big. I mean, that's big for an 8-week period. The range of weight loss was a low of 9 or 10 pounds, and one guy lost close to 30 pounds. He had put on a lot of weight when he went on his treatment, and it just came right off. I mean, he was just like, he was a star. And then there was a big decrease in body mass index. I mean, a 2-point decrease is big. That's about a 10-pound decrease. So in this study, I measured insulin glucose, and I also saw this in the breast cancer study, was only some of them had decreases in insulin and glucose. And this is right when we were finishing up this study, is when I read Tom Mueller's book, Extra Virginity, looking at the adulteration of olive oil, and I thought, oh, this could be my problem. I'm not giving them real olive oil. So that's how I became friendly with him, and I emailed him and said, asked him some questions, and we started talking about it and the importance of using correct olive oil. So from this, you can say that men with recurrent prostate cancer will lose weight on this diet, and they probably would have a decrease in their insulin and glucose if they were truly using extra virgin olive oil. In fact, for prostate cancer, a serving to 2 a week, so like a half a cup, US half cup to a cup a week, cuts prostate cancer risk in half. I mean, it's huge.